Good morning, colleagues. Welcome to this Geneva Urban Debate dedicated to the new pandemic treaty and its implication for local and regional governments. Before we start, a few housekeeping matters for you to know. The event is being recorded. It will be made available on our website afterwards. It will be conducted in English only, but there's translated captioning available on Zoom so that you may follow the meeting in your preferred language. Don't hesitate also to use the Q&A available on Zoom to raise questions and make any comments that you would like to during the event. We'll hold a discussion, and then at the end, we'll leave some time for questions and answers. My name is Anne Duong. I'm the co-director of the Global Cities Hub. And for those who don't know us yet, we are an organization based in Geneva that pursues two objectives. First is to connect cities and regions to the United Nations and other international organizations to enhance the influence of local and regional governments in the work of those international organizations. And to do so, we encourage states and their international organizations to engage with cities and regions and vice versa. And second objective, we promote the urban on the agenda of the international community, because as you all know, our future is urban and we have to pay more attention to the phenomenon of urbanization. So Geneva Urban Debates are events organized by Global Cities Hub in partnership with UN Habitat, and that focus on the urban dimension of any global issue, basically, debated in Geneva. You may wonder what urban dimension we're talking about when referring to the new pandemic treaty. But actually, the new pandemic treaty that was adopted at the 78th World Health Assembly that just finished last month. And so while the urban dimension has not made it to the final text, unfortunately, it does matter when we talk about preventing, preparing, responding to pandemics. And we've seen it, all of us, during the COVID-19 crisis, with 90% of all reported COVID cases, urban areas were the epicenters of the pandemic. The size of the urban areas, their population, the high level of connectivity made those urban areas particularly vulnerable to pandemics, to the spread of the virus. But at the same time, what we've seen during the COVID-19 is that local governments and regional governments were critical, during the response to the COVID-19. They really were frontline actors in crisis response, in recovery, in rebuilding societies, economies that had been, really disrupted by the crisis. We all know it, local and regional governments have a leading role in service delivery, economic development, and infrastructure investments, and therefore we're not surprised about their frontline responding role. And so basically, there's no doubt about it. Local and regional governments will remain critical when the next pandemic hits, even though their mandates and responsibilities may vary across different states. They have different competences, but they will remain in the front line. So basically, what are the implications of the new pandemic treaty for local and regional governments? That's what we're going to explore today. Allow me to start with Graham Alabaster. You are the head of the Geneva office of UN Habitat, and you've devoted part of your career, basically, at UN Habitat to water, sanitation, and more generally to urban health issues. So just to introduce, what is the role of UN Habitat in relation to pandemic prevention, preparedness, and response? Will that pandemic treaty basically change the way, modify the way a little bit that you work on the ground to address urban health? You have the floor, Graham.
Thanks very much. Well, delighted to be with you today. As you say, Auntie, this is an area of very high importance for UN Habitat. Yes, because the world is principally already urbanized, but the other issue, which is very important, is that we are still a long way to go in the urbanization process in many parts of the world, in some areas globally. 60 up to of all the urban space that exists in 2050, 60% is yet to be built. So because many of the diseases, pandemic diseases, infectious diseases, are so closely linked to environmental determinants, it's essential to make sure that as we move forward, that urban space is designed in a way that reduces these things. We saw in the one thing that came out, of course, about the pandemic. When you get a disease which is not treatable, for which there's no vaccine, you have to rely on classical public health methods. And this is in the pandemic where those who fared best in the pandemic were the ones who put in place traditional triaging and arrangements to deal with an infectious disease. So this is why, moving forward, the pandemic treaty is so important, because it will address this element and this solidarity and looking at these equity issues, which are so important in urban settings. If you don't look after the low income and the most vulnerable in a city, this is where infectious diseases is rife and it can be spread. So it doesn't matter what you do in the wealthy part of the city, you've got to focus your efforts principally on the most vulnerable if you want the whole city to benefit. So the equity issue is very well articulated in the pandemic treaty, and it's most important. The other thing is, and of course, we're used in many cases, particularly with health, we're dealing with national ministries and local government. But the issue is that when you're looking at the data and you need to interpret the data and understand the trends during a pandemic, you need disaggregated data at the urban level. You need to know within a country which cities are affected, which urban spaces. So you can only do that if you're working with the local authorities, the regional governments who have that information and data. So, you know, there's this great opportunity using the pandemic treaty as a chapeau to build on these local level structures, not only for data collection and the part of the pandemic treaty that talks about, you know, surveillance and sharing on pathogens and strains. We saw that in the pandemic with different strains of COVID being reported, but also as we move forward. Looking at the issue of designing out many of the diseases, as I said, many of these future pandemics are related to infectious diseases through lack of infrastructure. To give you an example, in many cities, particularly in the global south, when the pandemic came, because of the hygiene methods that were imposed, many of the traditional diseases disappeared. For example, if you went to a city like somewhere like Kisumu in Kenya, with the hygiene procedures for the pandemic, water-related diseases had disappeared for that period. So this reinforces the need to understand how we deal with these situations at the local level. On the other side, of course, aside from tracking surveillance of disease, understanding the mosaic of urban centres and the, if you like, the symbiosis between the vulnerable and low-income areas of a city and the high-income areas of a city are very important. I lived for a large portion of my career in Nairobi. Nairobi has something like 23 autonomous zones. Okay, understanding that mosaic is the local government's responsibility, and they're the only ones who make predictions and plan how we deal in the outbreaks of pandemic. So, I mean, these are the most important things. The other issue, of course, relates to One Health. We're told that the next pandemic disease will be probably zoonotic, right? It will be a disease where there's an intermediate host with animals and things. So, therefore, not just the metropolises and the megacities, but the smaller urban centres will be more at risk because of their relationship to the rural hinterland. So there's a need for much better understanding, particularly in the smaller urban areas, how we understand this critical relationship between the ecosystem where the diseases route through the pathways and how it affects the local area. So, I mean, moving forward from human habitat side, we want to understand better the relationships with urban planning and designing out these diseases, trying to minimise the inequities that exist to ensure that those who are most vulnerable are protected. I think the other important point is that in cases of pandemics, even if people don't lose their lives, there's huge impacts on mobility productivity. So, of course, the issue with the pandemic, it very quickly turned from a health crisis to an economic crisis, and there are many cities who are still facing this issue. So this, moving forward, the pandemic treaty must be very clear on how it embodies this idea relating to financing and the economic impacts of pandemics. So I think I'll more or less stop there. The only other issue I wanted to say moving forward, one thing that we're going to do with WHO is, as many of you know, for Habitat, we have now with our new executive director, focus is much more on one of our core areas of housing provision. Housing is a very interesting issue because it's where the social and the environmental determinants of health come together. So if you provide people with decent housing and the related infrastructure, you've got a much better opportunity to build in resilience against future disease. So we're going to be working with WHO on overhauling the housing and health guidelines, looking beyond just the household, looking at the neighbourhood, looking at the responsibilities of local authorities and the provision of services. So that will be our contribution to making bringing the pandemic treaty alive. Anyway, I've probably said enough already, but that's where I'll stop. Thanks.
But thanks a lot, Graham, because it's very important that you reaffirm the importance of the urban areas, basically urban planning, urban design, and looking at this pandemic treaty and how it will be implemented. Thanks a lot for that, for those. I know you'll have to go at some point, so please feel free to leave whenever you need. Let me now turn to our guest today. Main guest is Priti Patnaik. You are the founder and publisher of the Geneva Health Files, which is a journalistic initiative that started in 2020, same than Global Cities Hubs, where you basically report on power and politics in global health. And there's quite a lot to say about it in Geneva. As such, you've covered the pandemic negotiation from the very beginning, since, the very end, and you will basically continue to report on that. And you have extensively reported on the core issues, basically, of that treaty and its political dynamics. So before getting into the implication of the treaty for local and regional governments, I'd like us to rewind a little bit and go back to what this pandemic treaty is about. So we'll, focus on the pandemic treaty in general first, and then we'll go into what basically that means for local and regional governments. So Priti, I'll start with my first question about the origins of the treaty. What prompted states to negotiate a treaty on pandemics? And then what is the main objective of the treaty?
Thank you so much for the invite. Really pleased to be here. We've published about 120 editions dedicated to the global health negotiations over the last couple of years. That includes negotiations on the pandemic treaty, but also the amendments to the international health regulations. They're part of the same continuum of the reforms in the health emergency architecture. Pleased to be here. And just a disclaimer at the very beginning, I speak here as a reporter, as a journalist,
yes.
Not necessarily my personal opinions, but a lot of what we've gathered through our reporting and the insights shared, with that diplomats and negotiators shared from the floor, outside the negotiating rooms. A lot of this information has been gleaned over 3 years. And we just reflect what we heard, sometimes controversial, sometimes, there are lots of different kinds of pressures. Just to take a step back on what prompted states to negotiate a treaty on pandemics. The circumstances that led to such a decision, we have to review. It seems like a really long time ago, but in a relatively short amount of time, member states accomplished consensus on the treaty, and at one point it seemed really difficult given how contentious these discussions have been. So if you rewind to early 2020, there was a perception that how did we land in a situation like this? The only existing instrument, which is the international health regulations, there was a perception that they did not measure up for the moment. We needed something new. And you must remember that this definitely began very much as a top-down political project. And one of the chief mobilizers for the idea of a treaty came from the European Union, specifically from the President of the European Council, Mr. Charles Michel, but also a few other developing countries and middle-income countries such as Chile. So although it began as a political project, it took a while for it to gain momentum. But by March 2021, about a year after COVID-19, there were a handful of African and Asian countries, and of course European countries, that sort of sent out a call for a pandemic treaty. And there were notable treaty skeptics at that point, including China, Brazil, India, and Russia, among others. But eventually they came around. So the way they came around is for many countries, the international health regulations were central to any kind of sort of preparedness and response measures during health emergencies. But in time, there was recognition that, okay, we probably need something new because we do not want a repeat of what happened during COVID-19, and countries were actually very much in the middle of responding to the COVID-19 emergency at that point. So it was very challenging for capitals to actually set aside time to talk about what comes next, because they were still in the middle of it. So what they decided in their wisdom is have two-track negotiations. So decided how to strengthen the existing international health regulations while also kickstarting a process to think up a new treaty from a scratch. So for much of the last 3 years, the international health regulations, the amendments, the negotiations concluded successfully in May 2024. They were adopted by the Assembly, and then they could finally sort of dedicate all the time and energies to the conclusion of the treaty negotiations. It was extremely tough, not only for Geneva-based negotiators, but also capital-based folks who would come and sort of have these two-track negotiations running in parallel. So that's a little bit about the background. And also remember that when the negotiations started, we were in a different world. We were we had two wars. We have had two wars since 2020, since 2021. And of course, in January 2025, the United States withdrew from the negotiations, and that sort of gave political impetus towards pushing states for multilateralism in global health. And that also contributed to the conclusion of the treaty negotiations in April 2025. So yes, sorry, it's a bit of a background, but I think it's important to know the political motivation. So ultimately, I think it's a mix of the need and desire for political legacy among actors, but also the fact that we needed something new because existing rules are not covering us enough. So on the main objective of the treaty, so ostensibly equity, right? So for a lot of developing countries, equity was what brought them to the table. That next time round, we want to have greater agency, greater decision-making power, and it's a completely different conversation on whether you think that the new pandemic treaty is going to deliver on that. It makes modest progress on some of the accounts. But of course, there are also commercial considerations. So the motivations of the treaty was, yes, equity, being embedded as a principle, and for sure, without a doubt, there are a number of key provisions that have sort of moved the needle on things that did not exist before, on prevention, on sustainable production, local manufacturing, conditionalities for public funding for research and development, the pathogen access benefit sharing mechanism that is still going to be negotiated on, and a number of other issues we can go into detail. So I think that there is, among among a few actors, particularly CSOs and maybe even some countries, that yes, this is a legally binding agreement, but a lot of the language is caveated. And you'll see the same for commitments from and role of local and regional governments, for example. A lot of it has been watered down, but there are possibilities, and I think in the end, a lot of countries see this as a starting point, and this is just really the beginning of the process. Much will depend on the implementation. So I think if you would like me to.
Yes, thank you so much for that, very comprehensive introduction diagram about, really the political origins. I think it's important for us to understand where it came from and which countries, basically, which groups of countries supported it. Equity, as you said, is very central to the pandemic treaty, but I like what you said about the fact that there are also commercial considerations, and we'll get back to that. But as you mentioned, there are a few, provisions that were very core to the treaty, and on which basically all states focused on during the negotiation. And a lot of the issue that interests us was somehow pushed a little bit aside. But so states concentrated a lot on this pathogen access and benefits sharing system, which was very central. The transfer of technology, know-how, skills for the production of pandemic-related health products, of course, and I mean here vaccines, diagnosis, protection equipment and all that stuff. The One Health issue that Graham mentioned, and funding. Of course, in French we say that's the nerf de la guerre, the funding. So could you briefly, really, refer to each of those concepts and what does that mean, basically? What are the advances that have been put forward by the pandemic treaty, starting with the PABs, knowing that this PABs, the pathogen access and benefits sharing system, will basically be part of subsequent negotiations starting in July. So let's start on the PABs, transfer of technology, One Health, and funding.
Yeah. So before that, I just like to react to something you said, which is that for a lot of different stakeholders, the treaty was a carte blanche. So you're not the only ones who feel that they would have seen stronger language, but the fact that an international negotiation was crunched up into 3 years meant that they had to really prioritize a lot, and that meant that some of the other issues did get left behind. So specifically, and yes, these have been core, and really out of it's a 30-page document with 35 articles, and much of the 3 years were really dedicated to these 4 or 5 issues that you have pointed out, and one is linked to another. And the other thing I'd also like to say that these were negotiations on the pandemic treaty, but you must remember that this is much more than the pandemic treaty itself. It's really about rules in global health governance, the normative force of this document, and this goes beyond biomedical measures. In some sense, it also sets the agenda for other areas. So on PABs, the pathogen access benefit sharing was described as really the heart of the treaty, because for the first time ever, countries have agreed to negotiate a multilateral mechanism in global health for the exchange of information and on pathogen samples and digital sequence data in exchange for benefits that will result as a consequence of sharing this information. And those benefits can include, monetary contributions, access to medical countermeasures, among other benefits. So this is something that has been in principle agreed on, and you'll find this under Article 12 of the Pandemic Treaty. But they have only agreed to the principles and a broad idea of what PABs will entail. But the nitty-gritties and the contractual obligations flowing from such a system is going to be negotiated as a next step in the coming months. And that will be negotiated by the intergovernmental working group that will be set up in the coming weeks. Yes. So we can come back to PABs later if there is interest and if there are questions, but I'll leave it at that. And just if I sort of go through it in a in the way it flows in the treaty. So of course, prevention and One Health were key demands and one of the most contentious throughout the discussions. At the beginning, there was a perception that prevention, of course, was definitely a demand, a key demand for developed countries, but not only. It is a priority also for developing countries. And One Health was more contentious as well, especially because without enough clarity on where the resources for implementing these new obligations would come from. So that was some of the concerns underpinning these discussions, particularly on these articles. Sustainable production as linked to technology transfer, you must look at the equity provisions as a whole arc of what it means for global health. So starting from research and development, Article 9, sustainable production, Article 10, which is the first ever articulation of a commitment on sustainable production anywhere in any international agreement. So that's important. And then, of course, you have technology transfer, Article 11, and going on to PABs, which is a negotiation within the negotiation. And you also had Article 13, which is supply chain. So you have to look at this as a spectrum of what it means for access for research and development of medical products, to making it available, transfer of technology, and also addressing supply chain and procurement issues, including for vulnerable groups. So you will see references to the issues that Graham raised in his initial intervention. You will see references to vulnerable settings, people in vulnerable situations across these provisions. So it's quite holistic in the way they have approached these issues. So even if there isn't a dedicated language, but you will see references to this, and they have tried to sort of strike a balance in how some of these provisions have been articulated. And then coming over to funding, actually funding was something that was resolved, I would say, relatively early, sometime in 2024, and it falls short of recommending a new funding structure. There was a lot of debate, but for the moment, what was finally agreed on basically is a coordinated financial mechanism that is applicable to both the international health regulations, the amended version, and the pandemic treaty. The idea was to not cause further fragmentation. So what they will do is they will assess available funding sources and then try to sort of consolidate and see how it could be applicable for the implementation of the treaty. And this is linked to subsequent action by the Conference of Parties. So there are these sort of foundations that have been laid, and of course most of these issues have been pretty contentious for one reason or another. They were deeply political and contested negotiations.
And that's why it took so long. Although, like commentaries in the news were saying, well, 3 years is not so long, basically, for such a big, new agreement on pandemic. Thank you so much. I think we kind of, got over. You provided the main picture, over, the main provisions of the pandemic treaty. Before we go into what really matters for local and regional governments, can we just check if there are questions? I know there was a question about the situation in Pakistan, but I don't think we should here really address the specific, country situations. Are there any other questions you would like to raise on the pandemic treaty in general? And I'm also looking at the room here. We have some delegates in the room. Any question, comment on the main? No? If not, then let's move on to basically the relevant articles or relevant language, I would say, in the new pandemic treaty that, as you have said, was very, very long, and that has been shortened, and therefore we lost quite a few references to urban setting, to local authorities, unfortunately. But at the same time, we understand that the lead negotiators had, at some point, to kind of shorten the text and not to basically satisfy everyone's with all the different demands. Would you like to run, through the treaty and tell us, where there are basically relevant references to local and regional governments? so that we have an idea about what can be used, what can be relied upon by local and regional governments when referring to that treaty?
Sure. So I think that we could sort of look at it from the beginning, and you will see that there is a reference in one of the preambular paragraphs on the importance of multi-sectoral collaboration at national, regional, and international levels to safeguard human health. And you'll also see in the use of terms. For example, they have defined pandemic emergency and what constitutes a pandemic emergency. The different criteria. Of course, a public health emergency of international concern caused by a communicable disease, and then there are indicators. There are sort of sub criteria on the geographical spread and the risk of exceeding capacity of health systems, and the potential to cause social and economic disruption. And the fourth one requires rapid, equitable, and enhanced coordinated international action with the whole of government and whole of society approaches. So I think this is key, and you remember that, as I said, the IHR and the pandemic treaty is seen as a spectrum, as a continuum in the health emergency architecture, and therefore the definition of a pandemic emergency is important. If you think back to COVID-19, a public health emergency of international concern was declared at the end of January by WHO, but it was not until they called it a pandemic in mid-March of 2020 that people actually woke up across the world, both in developing and developed countries. And sort of a dawn that you have to involve all segments of the society, because you cannot get a coordinated response without that. So I think that reference is important, and we can go through sort of the relevant sections, and we can, we will come back to the way it flows in the treaty, but we can exceptionally head to Article 15, which is whole of government and whole of society approaches. And I think this is, before we sort of look at the language here, the thing to keep in mind also, which we discussed earlier, is that throughout these discussions, there was this whole concern about sovereignty. And a lot of disinformation around this process was about an international agreement, stepping on toes of member states, and there is nothing of that sort here. But this is not limited, to the pandemic treaty. Some member states feel strongly about some of the issues. So if you were expecting an empowerment of subnational authorities or regional authorities or municipal authorities, that would not come in this instrument, because you have to also recognize the undercurrent on sovereignty. And sovereignty is an issue that also came up in the context of the pathogen access benefit sharing, for example. This is not limited to, I think it was difficult because there are so many sort of internal factors even within a country, and multi-sectoral collaboration is an aspiration, but it's often difficult to implement. But I think the pandemic treaty tries to articulate that and tries to have commitments around that. You will see that also in Article 4, for example. So if you look at Article 15, parties are encouraged to apply whole of government and whole of society approaches at national level, according to national circumstances, that you must read as a watering down of the language, to empower and enable community ownership and contribution to community readiness for and resilience to pandemic prevention, preparedness, and response. So community ownership and contribution, of course, will involve local and regional entities.
And maybe, if I may, that's
Sure.
an important point that you're making, because a lot of references in the text are made to community community engagement, community awareness raising, as you say, community readiness, resilience, but actually we always forget that step about local governments between the central states and communities. And I think it's very important to reaffirm that. It's difficult to imagine community engagement without, having involvement of local and regional governments. And maybe if I may bounce back on what you said about sovereignty, that's something that affects the whole of city diplomacy in general. There's a lot of resistance from member states, understandably, about having more, involvement, more a louder voice of local and regional governments because of their sovereignty. So that goes really across the board in human rights, humanitarian affairs, like environment and you name. Sorry, let's go back to Article 15.
So I think if you look at the text, including para 3 and para 3A, for example, each party shall, taking into account its national circumstances, promote and facilitate the effective and meaningful engagement of indigenous peoples, communities through local communities as appropriate and relevant stakeholders, including through social participation as a part of a whole of society approach in planning, decision-making, implementation, monitoring, and evaluation of policies, strategies, measures, and also provide feedback opportunities. So none of this will be possible without really deeply working with local and regional entities. And it also sort of pays attention to 3B, 15.3b, take appropriate measures to mitigate socioeconomic impacts of pandemics and strengthen national public health and social policies, including those for social protection, to facilitate a rapid, inclusive, resilient response to pandemics, especially for people in vulnerable situations, including by mobilizing social capital in communities for mutual support. I mean, these are issues that Graham also raised in his initial intervention. So, and of course, calls for collaboration with relevant stakeholders during pre, post, and inter-pandemic periods. So, which means that you don't have to wait for a health emergency or a pandemic to happen. You must have these processes and these engagements in place, and you don't need to wait for an emergency to occur to kickstart these preparedness activities. If you have any specific questions on 15, or we can go.
No, I think you're starting with Article 15, and it's not a coincidence because that's what we have also as Global Cities Hub been, advocating since the very start, to keep that article about the whole of government approach, which is, I think, we fared, 3-4 times in the whole treaty, but that's something, a hook for local and regional governments to say, you can't implement that treaty effectively without us, basically. And that's what we want to highlight today, to have a very close look at that Article 15, so that local and regional governments can basically, again, use it to advocate for more capacity, for more resources, for them to implement that part. Maybe we go to other articles. You mentioned earlier pandemic prevention and surveillance, as well as One Health, that was also mentioned by Graham. Maybe just, briefly going over that to just for local and regional governments to realize what's in there for them.
Yeah, so in Article 4, and on pandemic prevention and surveillance, and also looking at Article 5, which is One Health, we can look at it collectively, and of course, the language on One Health is really seen as a game changer in a global health treaty, and has been quite contentious. So on Article 4. They highlight comprehensive multi-sectoral national pandemic prevention and surveillance plans, and surveillance related activities cannot happen without the involvement of local authorities, and I think that's something which is key. And the other thing which was contentious in these discussions on the negotiations on this particular provision, for example, was if you look at 2B, the last phrase reads, while recognizing the importance of safeguarding communities' livelihoods and food security. The thing I'm highlighting this because this was a key concern for certain countries and certain stakeholders, because they wanted to avoid targeting of communities and their livelihoods in the event of an outbreak. So they do have this language on safeguarding communities' livelihoods. You can't take prevention measures without actually putting the community at risk. And 70% of the infectious disease outbreaks happen from zoonotic spillovers. And you have, and there is, of course, a coordinated multi-sectoral surveillance. Again, it was quite contested because these kinds of obligations did not exist in the context of global health. So some countries were worried about what it means in terms of commitments and obligations, and where will the resources come from. And to be sure, a lot of countries, including developing countries, are actually already doing this at their national and regional levels. There is also 2E, strengthening efforts to ensure access to safe water, sanitation, hygiene for all, including in hard to reach areas. So I think that there are a lot of hooks already existing, even though there may be a perception that this is watered down language, but there are plenty of hooks where local and regional authorities can play a role without actually waiting for an emergency to occur. And finally, on you will also see in Article 5, One Health. You can look at Article 5.3a. It says promoting the engagement of communities as well, which is an invitation basically that this kind of engagement, and you'll see in subsequent articles that potentially local entities can have a role in communications, in risk management. So I think that there are a lot of possibilities here.
Can we move on? I'm looking at the time a little bit. Maybe we get over Articles 6 and 7, which are about the health system and healthcare capacity. And again, we ask basically states to ensure that their health system are prepared, resilient, and that they have the capacity to respond. And for that, you need to involve local and regional governments, and again, provide them with resources and capacity. Can we just get over can we go to Article 18 about funding now? You mentioned it earlier. There's no new mechanism as such, because we didn't want to fragment the funding, basically, landscape. But is there something in there for local and regional governments when it comes to funding?
So, before I go there, can I just quickly also just highlight on 6, on preparedness, readiness, and health systems resilience. There is language on promoting the use of social and behavioral sciences and risk communication and community engagement of PPR. That's basically speaks to your constituency. And also on Article 7, health and care workforce, there are particular responsibilities. If you look at 3, it says each party shall endeavor to strengthen national capacities and designate or establish as appropriate national, sub-national, and or regional level multidisciplinary health emergency teams. And these are measures, like I said, that can happen even in interpandemic periods. All right. So and also on communication and public awareness, a lot of specific language on risk communication and effective community level engagement, and particularly on measures to strengthen science, public health, and pandemic literacy in a population. And you will agree that right now literacy and trust in science is at an all-time low, and I think that local and regional entities can really play a role in sort of building that before we hit an emergency, as it were. So sorry for taking an extra minute on that. But so on financing, I think it is less clear in the sense that because this is something that the conference of parties will still, there are certain terms of reference they'll be working on, and then they will assess what are the existing sources of finances, how they flow, and how they can be better suited to specific proposals for the implementation of the treaty and the IHR. But if you look at 4B, promote harmonization, coherence, and coordination for financing of PPR with the IHR as capacities. And the pandemic fund already exists, and those are certain sort of there are certain possibilities in terms of prevention and One Health. I'm told that the pandemic fund has certain grants along those lines, but we would have to wait to see how the financing arrangements take shape. But there is a provision to review whether this mechanism is working or not, and then potentially the conference of parties can look at it in the future again.
And on that, I think it would be very important that we lobby again, because most of the local and regional governments we talk to always complain about the fact that they don't have access to international funding for whatever, like reason, sustainable development projects, for climate change projects, but here also to better prepare and respond to pandemics. So that would be important. So overall, a lot of somehow obligations that will fall on the shoulders of the local and regional governments. We will expect quite a lot of them in order for that treaty to, become a little bit lively on the ground. But there's also that part of that treaty saying, for that you need to basically have domestic funding to make sure that you maintain health capacity, your health system up to a level where you are able to respond. And so I think it's a bit of a, I would say, two swords. We ask local and regional governments to implement a lot of things, but we also hopefully will provide them with more capacities and resources to do so in those different provisions that you mentioned. Time is running. What is next in terms of the process?
So in terms of the process, in the next couple of weeks, an intergovernmental working group will be set up, and there was a associated resolution that was adopted at the World Health Assembly when the treaty was adopted, and that spells out the next steps. So the first and foremost is the negotiation of the pathogen access benefit sharing system, because there is language in the treaty that the entry into force of the treaty will not happen till countries successfully conclude the negotiation of the PABs. So that's linked to the successful conclusion of the PABs. And at the moment, it is envisioned that the negotiations on the PABs could take a year, but maybe two. There are already indications that it could stretch till two, because it is complex, but it will also depend on the political will of negotiating parties to conclude it as quickly as possible, because there are a number of provisions that are at stake that could come into force, that countries would want the treaty to come into force, because there are a number of good things that they think this treaty will help with. And once, as I understand, once the negotiations of the PABs are over, or there will be some kind of preparatory work that will begin when the treaty enters into force, then the conference of parties will meet and can hit the ground running, because some of the preparatory work has been done by the intergovernmental working group. So that's where things stand. So we are at the brink of another potentially not hopefully long negotiations, but fairly technical and political negotiations. The one other thing I wanted to add in response to what you said earlier was, I do think that there is a certain a political role that local entities can play. Yes, there is what it is in the treaty itself, but I believe it is a constant sort of interaction and constant contestation of responsibilities and rights. But as you know, it is in health emergencies, what we face during COVID-19 much depends on last mile.
Yes.
And these things cannot be built overnight. So I think there needs to be a culture of moving to that point where local communities cannot be empowered overnight. So you need to have those systems and a process, and more importantly, culture. And of course, there is a diversity in ways cities, countries are governed, because of various political structures and so on. But I think it's what they intended to do for this document to be a starting point, and to take what you will and turn it into how you implement it across countries.
And I think I would like to put emphasis on what you just said. That treaty basically is also a tool for local and regional governments to ask for those new channels of communication, basically for this dialogue that should be ongoing. As you said, communities cannot be empowered overnight. You need to establish a relationship in relation to health issue at the national level, and that tool is looking at that in an implicit manner, I would say. But for it to work, for it to be effective, it cannot work without that. And I think that needs to be understood. Sometimes it's a little bit forgotten by diplomats who negotiate those very important treaties, but don't spend so much time about how it will be implemented. And I think this is where local and regional governments and private actors very much in this treaty also, come in. Thank you so much. In terms of how many years, you said, when we prepared the event, you wouldn't, that the treaty might only enter into force in like 4 or 5 years, basically. So it's really a little bit far away.
Yes, because if you assume a year of negotiations of PABs at a minimum, or possibly 2, and then you need 60 parliaments around the world to ratify it for the treaty to enter into force. This will take time. So while there is political will, the world will be a different place, and we already have a number of health emergencies snapping at our heels. So there is urgency, but it will take it will take time.
Do you feel that political commitment will continue now that somehow I guess some delegations are saying, oh well, we just adopted the pandemic treaty, and we had to start over again with the PABs getting into details. Will that political commitment, it's hard to respond, but what is your feeling about it?
I think there is a lot of interest, at least from what I gather, on the part of developing countries and also developed countries, of course, because for many people, PABs is the only tangible benefit of a pandemic treaty, because for the first time ever, it talks about a minimum assured access of 20% of access to medical products in real time, that 10% donation to WHO and 10% at affordable prices. So I think that that is important. That is what countries, delegates go back and tell the countries that this is what we have got from the treaty in terms of the tangible benefits of the treaty. So I think there is a lot of interest. And of course, like I said, that the commercial considerations of having streamlined access to pathogen samples from across the world is a huge factor. And the resulting data that will occur through this mechanism. So there is political will, but it's not going to be straightforward like everything else in this process. So I think that there is will, and there is appetite to conclude this.
Thank you, Preeti. Are there any questions or comments? No, everyone is very silent, or listening very carefully to what you say. One more question. You mentioned the pandemic fund. You were referring, I think, to the pandemic fund established by the World Bank. All right, different organization, different landscape, but still kind of focus on pandemic prevention, preparedness, response, I believe. Can local and regional governments have access to that fund?
It will depend on I think the calls. There have been at least 2 or 3 calls, and it really depends on what they are looking to fund. There are possibilities. It's of course very competitive. One of the assessments made earlier by a number of experts was the annual cost for PPR is estimated at 10 billion.
PPR is pandemic prevention, preparedness response.
Yes, I apologize for the acronym. So I think that, but they are massively underfunded. So and it's the competition for grants, of course, is tremendous.
Do we have an idea about the scale of the fund?
Initially, it was about 2 to 3 billion.
Okay.
The one thing that I would like to also sort of come back to at this point is on specifically on the role of local and regional governments in the implementation. There's in Article 21, you do see that there's a requirement that the parties would have to report back, and this process will generate information on how various countries are implementing the different provisions and so on. And I was told that this could also potentially be something that local and regional entities can use to go back to their own governments and armed with this kind of a comparative data, look at the preparedness, across in our region, for example, and how are we faring. And I believe that level of reporting, I mean, it's very weak in terms of ensuring compliance. The language is weak, but there is a reporting requirement, and that is potentially something that local and regional entities, and in fact, even civil society organizations and other stakeholders can play a role.
Yes. And thanks for pointing at that, because indeed, as the Global Cities Hub, we've been pushing for local and regional governments reports throughout different processes, be it in climate change, when you have nationally determined contributions, and we push local and regional governments to also provide their input to those national reports. It's the same for the plastic pollution negotiation at the moment. There will be reporting obligation. We're asking local and regional governments to also be able to provide input. Same in human rights. We'll have interesting workshop in July about how basically local and regional governments can provide input for treaty bodies, for the UPR, Universal Periodic Review. So really, that's one of the major hook as well. Not super maybe, easy. It requires a bit of work from local and regional governments to gather data, to analyze it, to basically establish that dialogue channel with central government. But definitely, if we could have local and regional governments reporting back as well, or at least contributing to national reports, that would really be a game changer, I think, in terms of, involving them into the process, basically. That definitely, again, would be really significant, a significant progress from our point of view as Global Cities Hub. Thank you so much, Kriti. We're coming to the end. We have 3 more minutes. No questions at all. All right. Okay. Any questions in the room or comments you would like to make? No? All right. Maybe just to say that during the negotiations, it hasn't been that easy to follow, because negotiations were closed to civil society, to other basically actors. It was states only. You got your information by talking to a lot of delegations, but it was difficult. And it would have been difficult if local and regional governments wanted to basically take part in those negotiations. They would have needed to speak to their national delegations and be included in national delegations. I don't believe any delegations, national delegations, included local and regional governments, unfortunately. I don't think that was the case. But if there are states online and in the room, make sure next time, even in the conference of parties, to include local and regional governments, representatives of those subnational governments in your delegation. That really adds value, because it's really the link to what's happening on the ground, to how do we basically engage with community, raise awareness, make sure that the primary healthcare system is also up and working.
Just one thing also on that, most of the delegations, of course, were represented by public health experts, trade and foreign ministry, and health officials. On the last thing is that we are in a crisis right now, and global health is in crisis right now because of the funding cuts and so on. So you have challenges in TB, HIV, and immunization, and I believe that these entities already have a role in even capturing the extent of damage that's happening right now within communities. And I think that especially migrants and a lot of this information is getting lost across countries. And I think that we don't have a declaration for a pandemic of the kind of challenges we're already facing now, but this is something that it is crisis mode already.
Thank you so much, Priti. Thanks to all the participants to this very short Geneva Urban Debate. I hope you learned a little bit more about the pandemic treaty, how you can use it as well to, again, get into contact with your central government to, again, ask for more support, be it financial support, but also political support at the local subnational level to be better prepared for the next pandemic. As you said very rightly, Priti, it's not, you don't need to wait for the next pandemic to hit. Basically, you can start already right now, look at all the provisions in that treaty to basically see how you could most effectively implement them, again, in very close collaboration with your national government. I think we'll close it there. Thank you so much for everything. Thank you, Priti, for your enlightening, perspective, visions. Thanks for making that incredible work of reporting. I've learned a lot through you, I have to say, but it was, even more detailed today. And I hope we will meet again because, as you understood, the process is not over. We're far from having a pandemic treaty that will, enter into force tomorrow. There's still a little bit of work to be done, and therefore, I think we will need to again meet to inform you about the developments of that pandemic treaty. Thank you so much.
Thank you.
Bye bye.